Hello, last question is from MK. Yeah, all right, MK Ultra. Great. Yeah. So I heard Dr. Oz, okay, all right, on the SH show, whatever that is today, talking about hydroxychloroquine. Oh, okay, fine. Like, I thought we put that one to bed, but okay, let's wake it up again. Brush off the dust and yeah, have another go. He was talking about a randomized test with 1,200 people, and that this type of test is top of the line. What the heck is top of the line? That's not a sciency word as far as I'm aware. Or maybe it just means like the best possible way to do the test. That would be part of it. So the question actually goes on. Yeah, MK knows what's up here. Yeah. This doctor has been prescribing the medication for lupus and other immune diseases. That sounds like some of those old cure-all things, but potentially, I guess maybe there are treatments. But was it St. Thomas Aquinas or somebody that said, "Don't trust the man of one book, and also don't ever trust the physician of one treatment." Yeah, because chances are it is probably not the best for everything. Let's see. End result is how it's safe and low doses have no side effects and many people take it. Well, maybe, yeah, sure. I think that's pretty good. So as far as hydroxychloroquine, it does seem to be safe in healthy people, or in some kinds of sick people. It specifically does not seem to be safe in people with severe COVID-19, and that's who it's being prescribed for in very large numbers. The signs show that it either does nothing or actively makes things worse and makes people die at a higher rate than they would have otherwise. And so there isn't any good news there to suggest that it's really secretly effective, but just the results aren't showing it right now. Yeah, so whatever. Yeah. um, and so I thought a top of the line test is a double blind test, yes, with a placebo control, yes, to compare responses. Yeah. So what does that mean? So blind means that, so imagine I'm doing the experiment. So blind would mean that I don't know who is getting treatment, or placebo would be something else that's actually not the treatment. It can be a different kind of a treatment. You can compare two different kinds of treatments, or you can give them something like a sugar pill. Yeah, that's not going to hurt them, but it's not going to do whatever the treatment does. And this is a good way that you can actually establish that, okay, this treatment is actually doing something useful. Because you have a big pile of people that had it, big pile of people that didn't, same conditions. You want to make sure that they are matched. You want to have roughly the same number of people of the same age. You want people of different ethnic backgrounds to be equally mixed among the studies. Yeah, you can't give everybody that looks like you the good drug and everybody that doesn't the placebo. Yeah, or else you won't get a scientifically valid answer. So those considerations go into it. And so the question is, well, how if I don't know who's in which group because it's blinded, which is good because there are these things. Confirmation bias is terrible. If you know what's true, people will tend to overlook facts that don't agree with what they already think and tend to hold on to facts, however tenuous, that seem to agree with what they think, and end up at totally the wrong conclusion, for very well-meaning but bad reasons. So that's where the double blind comes in. Double blind means that you have somebody else involved in the loop. And so you've got multiple people. You've got one person who is just assigning these people to different groups. And so that person has to know exactly who everybody is. But the double blind means that the people in the groups don't know which group they're in, and the person that's doing the experiment does not know which group people are in. So there has to be some kind of treatment that would look and feel the same to everybody. And so everybody involved in the actual experiment won't know, but you'll have these sort of referees outside the experiment that help to set it up. And they will actually also not be able to tell either the patients or the doctor what's going on. And that, a properly divided up or properly set up study, So it needs to be randomized, but it also needs to be balanced. You need to have roughly the same numbers of people in both groups. That's the best way to do it statistically. Even though you want to just test your thing, you've got to you've got to also test not your thing. And so no, unless there's more to it that wasn't being brought out. This is a weird talk show by a guy whose views I don't completely share, I guess. Um, at least in some cases, yeah, he said some things that just seem a little loopy to me. Um, but yeah, maybe there's more to this. I have not seen the study, and I did not watch the program, and so they may be rounding things off just to be able to bring them out to the public and make it in a digestible way. I don't know though. As your job as a citizen scientist and mine is to say, well, fine, but show me the data and show me exactly how you set this thing up, and then I'll decide what I believe. Thanks. Yeah. It's almost like scientific papers should just be the results as written there, and maybe some words about the results, and pretty much nothing else. And good scientific papers get pretty close to that. They give you just enough of a framework to know what's going to be happening, bare bones results, and then bam, little tiny discussion. This is kind of the what we should think and how it fits in section. And really, if you've done your job right and presented your data in a useful, meaningful way, people will be able to read and judge for themselves, and that is the goal. Yeah. So don't get your science from talk shows. I don't know. Maybe don't get your science from Dr. Ben, I guess. Yeah. But I'm at least trying to show you where the data is coming from. So yeah, I'm trying to be at least a step better, or a step, a little closer to the science for you. But yeah, it's still much better for everybody to go out and read the paper themselves. Um, yeah, and make their own conclusions, because yeah, that's how you're actually involved, and that's how you become an expert. So there we go. Thanks very much. This was Ask Dr. Ben.